Good morning, everybody. Today I'm going to present the study which I did for my thesis in two parts. The first one is comparison of optical coherence tomography features in patients with central serous retinopathy versus controls. CSER is a radiopathic detachment of the neurosensory retina. It is the fourth most common retinopathy after ARMD, diabetic retinopathy, and BRVO. And it occurs because of pathophysiological changes at the Reich's complex, which is RPE, Brooks, and choriocapillaries, which is the Haller's layer. The CSER is the archetype of the pachychoroid spectrum. The term was coined by Varro et al. In 2013. And AIOCMTC2 enables us for a detailed cross-evaluation of the choroid and its vasculature. The aim of my study was to compare optical coherence tomography features between patients with CSER versus normal controls. The primary objectives were to compare the choroidal thickness in treatment-naive patients coming for the first time and compare it with normal controls, and to compare anxiety scores between patients and controls. The secondary objectives were to study the other OCT features pertaining to CSER and to compare the basic demographics in CSER versus normal controls. It was an observational case control study. 100 cases presenting to retina services at Arvindai Hospital, Pondicherry were recruited after taking informed consent. And the controls were patients presenting to general unit at the same hospital. They had we took controls as less than grade 2 cataract and with no fundus pathology and having refractive error less than 2 diopters. They were age matched and gender matched. After taking consent, history, and basic demographics, preliminary examination was done, and EDI-OCT scan was done for all patients and controls free of cost. The OCT parameters noted were choroidal thickness, pachychoroid, subretinal fluid, pigment epithelial detachment, hyperreflective foci, and fibrin. I'll present the demographic results first. In my study, 87.5% were males and 12.5% came out to be females, thus reinstating the fact that CSER is more common in males. Whereas since we took gender matched controls, 86% were males and around 14% were females amongst controls. The average age in cases was 39 years, and in controls, age matched controls were taken around 40 years. For cases and controls, both the maximum population came from the rural area. The choroidal thickness was maximum for the cases as expected, which was 448 microns, and it was also high in the fellow eye in cases around 398 microns, and for controls it was within normal limits. Choroidal thickness more than 350 microns was taken as pachychoroid. So for the CSER eyes, 94% of the patients fell under this category, and 76% of the fellow eyes fell under this category. We also compared other OCT features, SRF, PED, fibrin, HRF, which were significant in CSER eyes, whereas in fellow eyes, only PED and HRF were found. CSER is because of hypopermeable nature of the choroid, which causes a breach in the retinal pigment epithelium, leading to the hallmark features. It is also responsible for increased thickness in fellow eyes, thus reinforcing the importance of follow-up for both the eyes. In my study, no correlation was found between age, gender, systemic history, and choroidal thickness. And no correlation was found between SRF height and choroidal thickness. To conclude, the fellow eyes also had a thicker choroid, thus reinforcing the fact that pachychoroid is bilateral. The need for normative database is important, creating a platform for further research. And importance of awareness of various disorders in the pachychoroid spectrum is needed for targeted management. These are my references. Thank you.